Today we'll be talking about the first gynae checkup. Women are so worried when they have to go for their first checkup, and unfortunately many of them, they don't even come for the routine pap test, that is the test which is for cervical cancer prevention, just because they are so scared of this checkup. We have seen patients that when they come for their, especially for the first checkup and even for the follow-up checkups, I have seen, even if they have had a child and now they have to come for some reason to the doctor for some discharge or something. Some of them, they say we couldn't sleep the whole night in spite of having a baby, So it's such a fear which is there in their mind. So today we'll talk about it, how simple it is, how quick it is, and how painless it is. So one is when you come to your gynecologist either for a preventive health checkup or for some problem. So we'll be first doing your general checkup, taking your temperature, blood pressure, weight and all. Then you will be walking into the room of the gynecologist. She'll be examining you from head to toe, which means we'll look for any anemia signs, or if there's any acne or some marks which give us an idea about some gynec disorders. Then we'll be examining your chest, that is the cardiovascular system, your respiratory system, to see any majorly evident problem. We will also do a breast examination. Again, we'll be talking separately about it, but we do a routine breast examination also to look for any lumps and other conditions. Then we do the abdominal examination. We examine your abdomen to look for any mass, the uterus being large, or if there's some enlargement of the spleen, liver, we look for that, or any pain, tenderness on doing the examination. After all these examinations are done, then we will be doing which we call it as a gynec examination. So what is gynec examination? Basically means we try to see your uterus, and also if there's any mass in the tubes and ovaries, we look for that. That part we are trying to look at. That is the specific gynec examination. So first of all, there is an instrument known as speculum. This is Cusco's speculum. It is like this. So it has got two lips. If you see, when we open it, we'll be able to separate the walls of the vagina, and through this we can see. So when we look through this, we are able to see your mouth of the uterus, which is called the cervix, and of course we can see the vagina as we are going in, the whole of the vagina, the mouth of the uterus, or if there's any growth, or if there's any discharge which could be normal or abnormal discharge. So we can look for all that with this. Now this particular thing, the moment we pick it up, the patients get very worried. And the first question is, will it pain, and what is going to be introduced if they are not, if this is their first examination. So when we introduce this, it's very, very simple. We put some lubricant so that you don't feel the pain. That is a xylocaine jelly. And then we go laterally, we rotate it and just open these, and we are able to look through as to your mouth of the uterus or the vagina and all if there's any problem. Now, the only thing which a patient feels with this is just a little pressure, which we call it as a potty pressure, as if you want to pass motion. Just for a few seconds, that's it. No pain, it's just this much. But they come with so much anxiety that sometimes when we are just outside, they just jump and they refuse to, get the examination done. So one is, allow us to examine you properly. This is a very, very important part. It gives us the whole picture about the vagina and the cervix, which we can see directly with our naked eyes. So do allow us this examination. It will cause no pain. It is required to take a pap test. Some women come and tell me I have not gone for my pap just because I was scared of this. So please don't be scared of this speculum. This allows us to see you properly. And then of course, once we see this, we remove this instrument. Then with a gloved hand, one hand in the vagina and one on the abdomen, we try to assess how is the uterus, how is the size of the uterus, if there's any mass on the sides, if there's any pain or any other. There are so many other conditions. And of course, when we are just starting the examination, we look outside at the vulva if there's any problem. The vulva, the urethra also. We are able to look at that from outside just with our gloved hands. So that is it. It's as simple as that. So do not miss your examination. If you have a white discharge, if you have some problem, go to the doctor. If you have not had a pap smear, according to when it was recommended, please go to the doctor, take your pap smear. Or if you have not seen the gynecologist for long, like you are in the perimenopausal age, or you are wanting to be pregnant, deciding to be pregnant, go and see your doctor beforehand, your gynecologist, so that if there's any problem, we can sort it out before. and you can be healthy. So that's all about the gynecological examination, especially when it's your first gynecological examination.